The EmergenCCC's app was created in response to the need for more CPR-trained individuals in our communities. As COVID-19 is making many of us hesitant to give mouth CPR, it becomes a necessity for good Samaritans to learn hands-only CPR. Compatible with iPhone, Android, and BlackBerry operating systems. Good job. Keep going. Push harder. Push faster.
The American Red Cross recommends wearing a face mask. Click each step below to learn the correct way to wear your mask.
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe, life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout, using the person's name if you know it. If there is no response, tap the person's shoulder and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step: call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
Cardiac arrest can happen anytime, anywhere. You can help save lives with a few simple steps of hands-only CPR. If you see an adult or an adolescent suddenly collapse, immediately check the scene for safety. Step 1. Check the person. Immediately approach the victim maintaining a safe distance to start your assessment. Assess if the patient responds to you by asking, "Are you okay?" Step 2. If the person does not respond, call Red Cross 143 or 911 for help. Step 3. If you or the patient is not wearing a mask, cover your face with a cloth or face mask. Step 4. Prepare to give chest compression. Place the patient in lying position and kneel beside the patient. Position the heel of one of your hands at the center of the chest and place the other hand on top. Interlace your fingers and lock. Straighten your elbows and lean slightly forward directly over the chest. Push at the depth of 2 to 2.4 inches with a rate of 100 to 120 beats per minute. Step 5. Connect the patient to the automated external defibrillator or AED when available. Do not stop until the patient shows signs of life or until help arrives. Saving a person's life through CPR is simplified with 5 C's. If, by any chance, someone experiences a cardiac arrest, remember to check, call, cover, compress, connect. Be CPR trained. Train with us and help save lives.
Acknowledgements and recommendations for future development.